Thank you for joining us for today's CITI program webinar. Today's topic is the challenge of Medicare Advantage plans and local coverage determination, and it will be presented by Kelly Willenberg. Dr. Willenberg is an expert in clinical trial billing and reimbursement whose knowledge of clinical trials management and research compliance comes from 30 years of clinical research experience with over 20 years in billing compliance. She owns a consulting business specializing in research healthcare compliance, is an experienced oncology nurse, and presents at various conferences for several professional organizations. She also serves as a managing editor on the Research Compliance Professionals Handbook for Healthcare Compliance that she assisted in writing.
Our learning objectives today are going to be to talk about and identify Medicare Advantage plan challenges for both drug and IDE, and they are different. We're going to describe the variance of local coverage determinations nationally and what some of those are and why those are so important. And then we're going to identify areas that cause frustration within this process and ways to handle the denials that sometimes occur with Medicare Advantage plans. So Medicare Advantage challenges, and I know if you're on this webinar, you are well aware of some of these challenges that we face on a daily basis with Medicare Advantage plans, both for the drug and for the IDE side. So a Medicare Advantage plan is an option that a patient may choose to receive their Medicare benefits through. And they can choose a variety of different Medicare plans. And in October of every year, we get a deluge of commercials and phone calls and various things, billboards around your city, I'm sure, about Medicare Advantage plans and how the Medicare Advantage plan can save a recipient money. If the recipient chooses original Medicare fee-for-service and stays with Medicare Part A and B, the government pays for the Medicare benefits in a drug clinical trial. But once they choose a Medicare Advantage plan, they are choosing a private entity that is an approved company by Medicare that covers the Medicare benefits through a process of the various things that a Medicare plan would have under commercial guise. So it's a commercial plan. And a Medicare Advantage plan provides all Part A, which is the hospital insurance, and Part B, the medical insurance coverage, plus that Part D prescription drug coverage that many of our over 65 population needs, because a lot of these individuals are on a lot of prescription drugs. And if they don't have a commercial supplement plan, they likely are going to look at a Medicare Advantage plan as an option because they will believe, and in some instances, it will save them money. And this is different than a Medicare supplement insurance plan, which many have from my parents' population, which is in their late 70s, early 80s. Some of the individuals stayed at a company long enough to have a retirement plan where they might have a supplemental type of insurance, which is called a Medigap policy, which helps to supplement the original Medicare plan. So many of the individuals who choose to stay with regular Medicare have a commercial Medigap plan. So how can you avoid denials in this area? So there are risky things that happen with Medicare Advantage, and some of it depends on who is segregating the charges between the appropriate payers. Who does the charge go to? Is it on the coverage analysis? Is the CPT code listed accurate? Are there things that happen with individual patients within a trial? Absolutely. But you have to have some common sense and be practical in how you are handling a charge review. And then who is ensuring that the professional claim, the pro fee or the professional read or physician visit is being synced up with the technical or facility charges? Who does that? Who ensures that everybody is following the same methodology? So what are some of the Medicare Advantage plans? They have policies. There's some resources. Again, the Medicare processing manual, the policy manual, the managed care manual, all these manuals have chapters that will I mean, if you haven't read these chapters, these are very difficult to read, but they are something that you should go look at, bookmark and tag, and refer back to when you have questions. And you know, always ask questions. If you get something that you're unclear of, you know, talk to the person in your claims processing area that handles Medicare Advantage. What I will tell you is many of these, what I would say are patient accounting, you know, revenue cycle people who handle Medicare Advantage. They are very knowledgeable in the areas that sometimes can cause a clinical trial claim process, you know, agony. They are well aware of what some of the local rules are. They know what coding errors occur. They know that how to fix some of the coding errors, and knowing who that person is and having a dialogue with them to understand what you can do to help them and what they can do to help you will help you down the line as to how you can do this process better and ensure that you don't have denials or local coverage determinations that creep up and will get you when you're not.
So we do have a few questions. One of the very first ones is, which MACs did you mention still require approval for IDEs?
Okay, so there are 5 that have some level, and they're all different. Some require submission of various things, some require an email, but they are First Coast, CGS, Noridian, Novitas, and Palmetto.
We encourage you to monitor the CITI program website for additional information about future webinars this year.